Kia ora. It's my privilege to present to you the 2016 annual report of the New Zealand AIDS Foundation, my first annual report as the Executive Director. The mission of the NZAF is to prevent the transmission of HIV and support those living with HIV as well as their friends and whānau. And I'm delighted to share with you some highlighted activities from the past year as we've worked towards that mission. In HIV prevention, the promotion of condom use through social marketing and community engagement has been the cornerstone of our work. We've distributed over 700,000 condoms in the last 12 months and reached over 100,000 people at nearly 200 events. Love Cover Protect, our African program, distributed over 13,000 condoms to members of the African community. Alongside condoms, we've been working to integrate the many tools we now have to combat HIV transmission. A test and treat strategy is based on the fact that if we can find those living with HIV who are not diagnosed, link them to care, support them to adhere to treatment so that they achieve viral suppression, their chance of passing on HIV is virtually eliminated. To this end, we've reoriented our health service to make sure that we're testing the right people in the right places. We've also integrated testing into our social marketing campaigning more than ever before. As a result, we have tested over 4,000 people for HIV through the service in the last 12 months. In the treatment space, we've advocated strongly for the removal of the CD4 threshold for treatment access. Against all World Health Organization guidelines and all of the international science, that threshold remains, and we'll be fighting hard for its removal in the coming year. Finally, we've begun incorporating pre-exposure prophylaxis into our strategy. PrEP refers to the use of HIV medication by HIV-negative people to reduce the chance of them contracting HIV if they come in contact with it. We've collaborated with Auckland Sexual Health and University of Auckland to develop a study which is going to assess the effectiveness of PrEP in Auckland's community. We're also collaborating with a number of stakeholders to ensure that there are effective pathways of PrEP access into the future for those high-risk GBM who struggle with condom use and for whom PrEP may be an appropriate prevention. Supporting people living with HIV as well as their friends and whānau is the second core part of our mission. In the last 12 months, we've had more than 1,000 interactions with people living with HIV in the form of one-on-one counselling sessions and support groups, for example. Our More Than HIV video series, a series combating HIV stigma and discrimination, has had over 15,000 views. Finally, we work with a number of HIV peer support organisations to collaborate in the delivery of HIV support and care. Moving forward, let us make no mistake. We're at a critical junction in this country's response to HIV. At a time where the tools do now exist to eradicate HIV transmission, we are seeing the largest number of new annual infections each year. Ending HIV is a truly aspirational goal, but I also believe it's a 100% realistic one. The NZAF is about to launch a new strategic plan, and I believe it's a plan that positions us as leaders in the HIV sector in this country. But we will not get the job done alone. To end HIV is going to require urgent and renewed political leadership. It's going to require a level of partnership and collaboration that the HIV sector in this country has not seen in recent years. And it's going to require you. The NZAF will only ever be as strong as its board, staff, volunteers and members. I want to thank you for your support in 2016 and let you know that I'm looking very forward to working with you next year and into the future. Thank you.